Schools have 20 days left of summer break. Of course, many students in South Carolina went back to the classroom this week. And the start of the school year, of course, comes with that checklist, right? You got your supplies, your clothes, and also your vaccines. But not everyone is checking that last box. And that's concerning for doctors and healthcare professionals here in North Carolina. Right now, the state reports more than 500 cases of pertussis or whooping cough have been confirmed. And that number is expected to rise with more cases under investigation. Earlier this summer, the Department of Health and Human Services reported its first case of measles this year in a child visiting Forsyth and Guilford counties. In both illnesses, doctors have stressed the importance of those vaccines, not just for preventing or weakening your child's symptoms, but for protecting the children around us who can't get vaccinated. And that includes kids battling diseases like leukemia.
His life would be in grave danger if he would have been exposed to measles and contracted it.
But many of those warnings are being ignored as a nationwide survey reveals increased hesitancy around immunizations. Dan Wells explains tonight.
Over the last 5 years, most counties in the United States have seen a decline in childhood vaccination rates, according to a new report from Johns Hopkins University.
10% of individuals are incompletely vaccinated before they enter school.
Dr. Carl Fichtenbaum is the president of the Infectious Diseases Society of Ohio, and he believes the decline in vaccinations is due to a number of factors.
There is a trend of people sort of rushing to their doctor now, wanting to get vaccines and wanting to get them a little bit early even, because there are some concerns that vaccines might not be covered in the future by insurance companies. There is also a trend of people being hesitant to take vaccines, and by and large that's related to a lot of misperception and misinformation about are vaccines safe and are they effective?
Nationally, the average vaccination rate fell from 93% pre-pandemic to 91% post-pandemic, according to the report. That represents a decline of about 3%, which is certainly a growing medical concern.
If our vaccine rate drops, these diseases are going to come back. And we've shown that over and over again. We've seen it with whooping cough outbreaks. We've seen it with measles outbreaks. We're seeing some mumps outbreaks.
Experts are worried that people might be influenced by personal opinions instead of science.
People say they're just routine childhood diseases and that kids are going to get better. If you look at a more recent thing as far as with measles, is that most of the kids, okay, they get better, but 15%, about 1 out of 6 kids that get measles ends up in the hospital. Kids go blind from measles. Kids have permanent brain damage from measles, and about 3 out of 1,000 kids die from measles. So it's not a benign disease.
And every medical doctor we spoke with agrees.
What vaccines do is they prepare your immune system so that you don't get as sick. So when we say that a COVID vaccine or an influenza vaccine doesn't work, really depends on your definition.
And for those that don't feel comfortable,
if you look back in the United States even 120 years, so around 1900, 1 out of 5 children in the United States died before their 5th birthday. I mean, that's almost incomprehensible now. But if you look at the causes of death, they were infectious disease causes that vaccines and other public health measures have eliminated.
Dan Wells reporting for us tonight. All right, back in the First Alert Weather